there is another piece to the rest of the story about Vision 2020, and I want to make sure that this gets logged historically. The idea about becoming the healthiest community has one other origin, and that was one day when Betsy Cotter and I were making rounds. We were visiting over at Community Health Center, and Nancy Sporborg was there. Is Nancy here? No. And talk about people who have ideas in this community and are committed to the community. And it was when I had just gotten into my position as Chief Medical Officer, and Betsy and I were making rounds, seeing how everyone was, seeing what's up. And Nancy said, you know, did you ever think that maybe we should try to do something really special? And I said, like what? And she says, like becoming the healthiest community in the nation. And I swear, that's exactly how that thought started. And Betsy and I were kind of like, wow, that's quite an idea. And right after that, after meeting Nancy, I went over to Art and I said, Art, you know, I was just talking to Nancy Sporborg. You know how she always comes up with these darn good ideas? Here she is with this idea, why shouldn't we be the healthiest community in Cheshire County? You know, Cheshire County should be the healthiest community in the nation. And we started to think about that seriously and then brought it to our senior administrative staff. And the rest of the story you see now, 4 or 5 years later. There was one other thing that I stole from Nancy that day. Up on her bulletin board was a saying, and it was to love what you do and know that it matters. What could be more fun, which is a Katharine Graham quote. I stole that off of it. It became one of our mottos. So I just want to make sure that Nancy Sporborg has been given credit for this. So can I have a round of applause for Nancy? So that's a great way to begin Vision 2020. And I was asked to speak as a champion for Vision 2020. And I'm really thrilled to speak in the role of living, modeling, sharing, and inspiring. But I want you to know if you become a champion, people watch what you do. And I can tell you when I go through the lunch line at the cafeteria at the hospital, people watch what I take and what I eat. And I can tell you that there are people like Yvonne Goldsberry around that if I'm eating a brownie, there will be a photo taken of me eating a brownie. So the story behind the Schlegelmilch cookie is, you know, we'd have lunchtime meetings where we'd provide lunch because, you know, people wouldn't have time to have lunch. And there was always like a plate of cookies there. And I said, do we really need a plate of cookies at lunch? I mean, who, you know, would eat a cookie unless you put a plate out? When you have a plate out there, it's calling your name. You have to eat a cookie. So I asked that we eliminate cookies. And you think, hey, I'm half of the office of the president. This should be easy, right? You know, I just say, get rid of those damn cookies from lunch, and we won't have any cookies. No, they kept showing up, showing up, showing up. So eventually, though, we did get them eliminated, which got me my nickname, the Cookie Monster, for eliminating cookies. And then Carrie came up with a solution, which was, why don't we just develop a healthy cookie, and that would, you know, that would be acceptable. And today, you'll get a chance to try the Schlegelmilch cookie. So, why am I so passionate about this? Well, what I'm passionate about is truly creating the cultural change needed to become the healthiest community. And that's what we're talking about here. We're talking about cultural change. In order to do that, you need many, many, many champions. And for me, it starts with a passion for this community. This is such a unique community. The Monadnock area is unbelievable. And I can tell you, I was born and raised in New York City, although you probably can't tell from my accent, can you? And, you know, for me to end up in a community like this, with so much social capital, so many wonderful, caring, and committed people, and a chance to actually change how we behave, how we take care of our health, how we create wellness, how we bring up our children in a healthier way, what an opportunity. So that's where it starts for me. This has such a tremendous sense of place. And I want to just tell you a little bit about my history. So I've been here since 1980. And in addition to being a rheumatologist, for the first 17 years, I did primary care. Okay, I had a primary care practice, and some of you I took care of as your primary care physician. over the years. And I saw so much preventable disease that killed many of my patients who I really cared for, and or really jeopardized their quality of life, left them with diseases that were preventable. And I tried as best I could, one-on-one, to try to help change behaviors. And perhaps back in the old days, maybe I did it in a fashion that wasn't as effective as it should have been. Maybe it was a little too scolding. Maybe it was a little too negative. But what we've learned is that's not enough, okay? Doctors, one-on-one, we're not going to change the culture of our community. We're not going to change each other's behaviors that way. It has to go outside the walls of the medical center in order for it to be effective. So I worked hard one-on-one, didn't feel that we were making the kinds of gains that we could make. 1996, I became the chair of our newly founded Tobacco Coalition, and then I found that, you know what, we could change culture. We could change the way our community thinks about tobacco. And Keene, in the Monadnock area, was one of the leaders in tobacco prevention. We had tobacco-free dining 5 years before the rest of the state. And even when they declared our local ordinance was not enforceable, none of our restaurants went back to smoking because we had created cultural change. And I want to use that example as we think about what we have to do. We tend to get this negative feeling about health and how are we going to make our communities healthy. And Carrie spoke about that. And if you listen to the press, particularly during healthcare reform debate, it was rather depressing. You think, we're never going to be able to figure this out. And you know, we talk about things like the obesity, childhood obesity epidemic, at least as if it was some infectious disease that we have no control over. And you know, we talk about the way fast food industry and the food industry in general treats us like we have no control over it. And this pessimism is really a form of learned helplessness that we can't let our community fall under. We're not helpless. In regards to health and healthy behaviors, we come up with all these things of why we can't do it. I don't have enough time to exercise. I don't have enough time to prepare the proper meal. Healthy foods are too expensive. I can't exercise. My knee hurts. And I can tell you, my knees hurt. And, you know, we come up with all of these reasons. And, you know, we have to change that. We have to come up with a model that's optimistic and empowering if we're truly going to change things. And we have to influence our social networks, those people that we hang with, our families, where we work, where we go to school, where we go to pray, our churches, our synagogues. This is where we're going to change the healthy behaviors of our community and become the healthiest community. So we're really talking about a different way of thinking, a different explanatory style for where we are. We're thinking about a different mindset. And as Gandhi said, a man is but the product of his thoughts. What he thinks, he becomes. And I want to say a little bit about this Monadnock region and its connection with transcendentalism, okay? That's part of our inheritance here that's uniquely New England, okay? And transcendentalism is about connecting to the larger community and even to the universe and providing meaning. And it's about hope and optimism and expecting the best in the future and working to achieve it. We believe that a good future is something that can be brought about. So, you know, in this community, in the Monadnock area, we are self-reliant, and we do hear a different drummer drumming. We do not have to have the pessimism that seems to be overcoming the country when it comes to health. So I hope that you will join me in this effort as a champion to live, model, share, and inspire Vision 2020. Thank you.